The first step for anyone that has decreased sound tolerance is to have a comprehensive audiologic exam so we can rule out anything that might be underlying, contributing to the cause of their response. So we want to bring them in and do a detailed case history, do the sound booth testing and measurements, figure out what's going on. Are there any red flags that we need to be aware of prior to starting sound therapy? And then we can give a diagnosis and present the best recommendation for each individual patient we see. Relief for every patient looks different. Some people will experience relief very early on if they follow our recommendations and protocols immediately from the start. Sometimes it's harder depending on the age of the patient, the motivation level of the patient, and the severity of their symptoms in terms of how quickly they'll see relief. But anyone who's motivated, who wants to get better, who follows the recommended treatment protocols should see progressively over time that their situation is just getting better and better, or easier and easier to tolerate everyday sounds again. We really know that it takes a full year to feel confident that we have a new neural pathway formed in the brain and that we're not going to slip backwards or relapse back to previous levels. So we really need a minimum of a year commitment from patients, but really what that looks like is probably 6 visits over the course of a year. So it's not anything that's done, weekly in person or anything like that. We really do a lot of the follow-up remotely, so that's nice as well. We can connect with patients via telehealth, via email, via phone calls. So not all of it has to be done in person, but the initial exam and coming up with the plan and executing the beginning of this plan is most effective in person. And then the follow-up, a lot of that follow-up care can be done remotely since the patient has the tools and the plan for treatment customized for them.